There we go. Yes. Good morning. Great to have all of you here. We're actually on WebEx today in telehealth, and we're also recording and videoing this. So speak up, stand up, be seen. So it's our first experience bringing it to all the facilities through our WebEx or telehealth program. So this morning we're going to talk about our strategic goals for the organization, and we're going to have the different flagpole presenters. And we have a guest with us today, Josh Ettinger from Category 1. Josh and his father, Joel, have worked with us over the last couple of years in developing our strategic goals. And today, and basically most of this week, we've been working with Josh on our Baldrige plan for our examiners who come in starting on the 28th of this month. So that's an exciting time, and I think you'll be surprised in what Josh will share with you with the fact that we are even getting an exam. Very few organizations throughout the United States make it to the site visit, which we will have starting the 28th of this month, and very proud that we're at this point in our goals. If you remember, in 2007, when we started the culture change within the organizations and the processes that we set up, the goal that we had was to be to the point where we could have a site visit from the Baldrige examiners, and we're fortunate enough to have that this year. There's a lot of work for us to go through, a lot of things we need to just think about because they're going to be out talking to all of us, and we just need to remember the things that we've been taught over the last 7 years on our processes and what we do as an organization and how we take care of people and how we respond to people. So with that, we're going to do our mission, vision, and values. And I'd like to ask Theron Becker to do our mission. No, that's fine. Very good, Theron. Thank you.
First time, remember you said that.
What'd you do? Nothing. I thought you were doing it back there. Okay, for our vision, I'd like to ask Justin Bryant. Justin?
Be the first choice in the care of every generation. Being, I say we all. We have people, they have knowledge. Be.
Thanks, Justin. And values, Kim Tarka.
I am positive, respectful, innovative, dedicated, and empowered. The most important one to me is empowerment, because when we empower each other, each of us strive for greater achievement across the continuum.
Very good. Thank you. Thank you. Okay, this is the agenda we're going to be following today. So we've completed our mission, vision, and values and our flagpole presentations, and I'm going to ask Craig to come up and do the service flagpole presentation. Too many papers.
All right, thank you, Mr. Babb. Well, I've been told I can't walk around, which I usually like to walk around a little bit, so I'm stuck behind the podium so our folks out there in TV land can see us. Okay. So to kick this off, just to start off, you guys all know why it's important for us to all understand what our strategic plan is. You guys understand the rationale behind this? I mean, if we don't have a plan for where we want to go, we're never going to be able to get there. And so that's what we're going to show you today is sort of what is on our strategic plan and what we expect you guys to do to help us get there, because we can't do it alone. It's got to be all of us together or we're never going to get there. And that is particularly true of the service goals that we have. Service is kind of an anomaly because it's sort of two-pronged. The first prong is we want to expand our service offerings and our outreach to the communities that we serve. So a lot of what's on our strategic plan for service involves expansion. So you can see completing the Douglas Center, which is just about done, but that allows us to provide more services to our customers. Developing a retail pharmacy in Bolivar, again, just stretching our reach out there and providing that service, which we right now don't do. So we need to provide that service to our customers. We want to develop an inpatient dialysis service, again, something we don't do. We send those folks to Springfield to have that done. We're perfectly capable of doing that here in Bolivar, so we just need to figure out how to do that and make that happen here. And then expanding our mental health services. Again, we have a great mental health service foundation, but we need to be bigger and better in that realm. So again, expanding that so that we can provide more services to our customers so that we are that first choice for customer-focused healthcare. We also want to continue our physician recruitment efforts. If we don't have providers that provide the services, we obviously can't do those things. So bringing in specialty physicians in particular is very important to our success and continued growth. We also want to improve the health of our community, so we do lots of things in the community to improve the health of communities that we serve, and we want to continue to do that because we want people to think about CMH as their first choice for customer-focused healthcare. And so by offering services to the community, they make that connection that, gosh, CMH is there for me, they can do these things, that's where I want to go to have my care. The last one is improve patient experience and loyalty. So we're going to spend a little bit of time on this because this is where all of us as the healthcare team come into the picture. This is really what we can focus on, and we can make a difference in the patients and customers that we serve. So patient experience and loyalty is kind of a nebulous thing. It's hard to understand what is it that we can do to make our patients and customers have the perception that they received excellent care. So where do you think we want to be? I mean, what would you guys say would be our goal for being for having good patient experience? What do you think that goal should be? Any ideas, any thoughts about that? I'm sorry, Gene. 100%, that's a pretty lofty goal. So we're not going to shoot for 100%. Obviously, that'd be awesome if we could do that. But to be realistic on our balanced scorecard, I didn't touch a thing. So to be successful, for you guys and for us to be successful, we want to kind of set our goals to be something that's fairly reasonable. And so what we're saying is that we want our patient experience to be at the 75th percentile for all the things that we measure for patient satisfaction. Okay, and there's lots of things that we measure. 75th percentile, that means that we would be the top 25% in the nation. And you guys understand how percentile works, right? It's a comparative study, it's a comparative analysis of all the other hospitals that participate in the same satisfaction survey, use the same satisfaction survey vendor that we do. And they stack us up against everybody else in that database, and it tells us how we rank compared to everybody else. So we want to try to be at least at the 75th percentile for all the things that we measure. So let's talk a little bit about the measuring process. Our patients are surveyed, our inpatients and outpatients, people that come to radiology, people that interface with our organization are surveyed through a vendor, our HealthStream vendor, and they're given a survey after they've had interaction with us. So they come to our facility, we provide services, and a survey is sent to them and they fill it out. We also use another survey tool called My Interview for Long-Term Care. And same thing, those residents are interviewed for their perceptions of experience, how satisfied they are, and we get those results back. So these are some of the responses that people can give to the response or to the survey questions. Always, satisfied, very dissatisfied, usually, sometimes, never, and dissatisfied. Okay? So lots of responses to questions, but did you guys know that only 2 of the responses actually count in how we're scored? So when we say we want patients to have a good experience, we don't want them to have a good experience. We want them to have an excellent experience. They have to be wowed when they come to our organization. The only things that count are the responses of always and or very satisfied. If they say they're satisfied or that we usually do it, that doesn't count. We don't get credit for that. So when we say we want to be in the 75th percentile, that means that the percentage of patients that reply always or very satisfied has to be very, very high for us to reach that 75th percentile. Does that make sense? I see some heads nodding. Okay. So that measure of always or very satisfied is called top box. Have you guys heard that term before? So the top box percentage, and that means that it's the percentage of people that rate us as always or very satisfied on the survey question. That's what we're striving for. You'll hear that a lot in your staff meetings probably. You'll hear the flagpole champions talk about top box. That is what top box is. It's the percent of people that give us always or very satisfied. So the job is we have to figure out how to become an always organization. Lots of tactics have been initiated here in this organization, and we're going to go through some of those. Hopefully you've heard of some of these. I'm not going to cover each one of them, but I do want to stop on a couple of them. So AIDIT, anybody not heard of AIDIT? Okay, that's the right answer. If you would have raised your hand, a gun would have come out and shot you. Okay, so everybody knows AIDIT. You know what that is. I don't have to explain that. Remember PRIDE, right? We heard Kim tell us about PRIDE this morning. Those are our guiding service principles. It's how we conduct ourselves when we interact with our customers. And who are our customers? It's everybody we come in contact with, right? It's our patients and residents, obviously. It's our visitors. It's vendors. It's our physicians. It's each other departments. Everybody that we come in contact with, we should be using our PRIDE guiding service principles. Narrate your care. What's narrate your care? Tell them what you're going to do. And I'm talking about what we would probably consider to be very silly things. You may think, well, I don't really need to narrate that because everybody knows what I'm going to do and they understand how this is. My challenge to you is don't assume anything. Assume that the patient or customer, resident that you're getting ready to work with has never done this before. They've never had a blood pressure before. We take thousands of blood pressures in a year. We know the drill. Patients know what it feels like to get a blood pressure. But if we say to the patient, I'm going to put this cuff around your arm, it's going to squeeze a little bit. It's so that I can get your blood pressure. I'm going to listen on your arm, and that's going to tell me what your blood pressure is. It'll just take a minute, and then we'll be done. What does that do for the patient? They know what a blood pressure is like, but they have confidence in you. It reduces their anxiety. That promotes healing. So it's very important. And so things just as simple as a blood pressure should be narrated. That's very, very important. So we need to narrate our care. Use appropriate touch. Sit when possible. The student group and other folks have studied this concept of sitting when you're in the room with the patient. And they've studied it to the point of having a physician, is the example that they used, comes into the room and spends the exact same amount of time standing at the bedside as he does or she does sitting at the bedside. And the perception from the patient is that when they were seated, they were there longer, but the time was exactly the same. So if we can sit down next to our patients, that's valuable. That gives that illusion of more time spent. Being present. So how do we be present? Listen, eye contact, right? What about baggage? Anybody not have any baggage in here? So I would submit to you, because we think of baggage in a negative connotation, I think baggage can be very positive too. Let's say that I have a daughter that's getting married next weekend. I don't. But let's say that I did. That's a happy time, but it's going to be on my mind. It's going to consume me, and it's going to perhaps prevent me from hearing what my patient's telling me and communicating thoroughly with my patient. So being present is important, and part of that is we got to put that personal baggage aside. We have to leave it at the door and not pick it up when we go home is what I would say. Let's just leave it there. Showing compassion, developing right relationships. What does that mean, right relationships? So it can mean a lot of things to a lot of people. To me, it means that we get on the level of our patient. We meet our patients where they are, and we help them understand what we need from them, and that symbiotic relationship is beneficial for both us and for them. I mean, we get the compliance that we need from them, and they feel comfortable about the care that they're receiving. So we have to develop that right relationship, meet our patients and our residents where they are, and communicate with them openly and honestly and all those things so that we get what we need from them and they get what we need from, or what they need from us. Did I say that right? Okay, thank you. Under promise, over deliver. This is what I call the Disney principle. And I know the department head folks get tired of me talking about this because I talk about it every month. But that under promise, over deliver concept has to do with duration in AIDIT. Right? If we know that the doctor's going to be in 30 minutes, let's tell the patient they're going to be in here in an hour. And then when he gets there in 45 minutes, we've overachieved what we said we were going to do. Right? The Disney principle is when you're waiting in line at Disney, it says your wait from this point is approximately 45 minutes. Well, they've studied that. It's actually only 20 minutes. But they tell you in line that it's going to be 45 minutes. Well, guess what? You get to the front of the line in 30 minutes and you think, wow, this line is really moving. They are really efficient. They're moving people through here. That's how that works. So we need to do the same thing. You know, we need to manage the time perception and under promise, over deliver. Be proactive. We are a very reactive group. We wait for the call light to go off. We wait for the alarm to beep. So let's stay on top of those things. We wait for the patient to tell us they're hurting. Let's stay on top of those things. Let's be proactive. Let's get on those things before the patient can even think about that they need that. Anticipate questions. Using keywords at key times. What does keywords at key times do for us? What's the main role for keywords at key times? Any ideas? It's communication. What it does is it helps patients and residents connect our activities, what we're doing, to what they're asked on the survey. Right? So if we walk into a semi-private room, we pull the curtain and we say, I'm pulling this curtain to protect your privacy. We know we're doing that. Does the patient know we're doing that? They don't know why we're doing it. They just know we come in and pull the curtain. But if we say we're pulling the curtain to protect your privacy, when they're asked, did the staff protect your privacy on the survey, guess what? They mark it always because we always did it. Okay, so keywords at key times are very important. We have to use those. We have to make that part of our normal day-to-day communication with our patients and residents. The last one is actively listening. And again, when we are present with our patients, we are able to actively listen. Anybody have any questions for me at all? Okay, so where do we want to be for our satisfaction goals for this next year? 75th percentile. And how do we become an always organization? Always do it. So if everybody except one person comes in the room and doesn't narrate their care, They just start doing their procedure or whatever they were going to do. Are we an always organization? So it takes all of us. We have to do it. We have to be consistent. We have to be committed to this. That's the only way we're going to move our scores, folks. So we've got to commit to it. 75th percentile this year, let's do it. Okay, let's do it. We can do this. All right, thank you all for your attention.
I'm going to have to move the microphone. I'm not nearly as tall as Treg. I'm also not Joni Heath. My name is Jeremy McLaughlin, and I'm the Director of Human Resources. I'm the former People Champion, but Ms. Heath had committed to provide a training at Appleton City today, and so she was unable to be here. So I'm going to try and fill her shoes. But I'm excited about the People flagpole and the things that are happening. You know, in the past, I've been able to show you guys this image of this pie chart from our employee survey. And what I was really excited about was looking back historically, where did we start? And Mr. Babb talked about it just briefly. We've come a long ways. You'll see down at the bottom our scores, and we measure things in people very similar to how they measure things in patient satisfaction or in the service flagpole. We only look at that top box from your responses. So those things that you say you're very satisfied with. If I looked at overall, the percentage of positive responses, we're in like 95%. So I know you guys are fairly happy, but I want you to be very happy as employees. So that's why we only measure that very satisfied. But we've moved on engagement from 41% very satisfied to 57% very satisfied. And when it comes to overall satisfaction, we've moved from 38% to 55%. So over half of the employees, are very satisfied with their organization as a place to work. And I hope you feel that excitement. I know when Josh gets up here to talk later, this Baldrige process, the MQA process that we go through to improve our organization, we get feedback from each of those surveys, and we try to look at the things that they give us as tips to improve. So when they come up to you in the next couple of weeks and ask you questions, be excited about it. We do a lot of great things here. I wanted to tell you a couple of things that are changing with the people goals. Similar to service, we're not going to be at 75th percentile. We're already at the 90th percentile, so we want to make sure that we maintain that. So the goals will be slightly different, but we're measuring almost all of the same things in people this year. And I'll show you in just a moment that the actual measures. You will see on some of them, like the 10, the 99th percentile may have changed a little bit because we've really been pushing, and the benchmark that we use changed. So we're going with what the benchmark is, and that's where we still want to get to. Now, next year, if the benchmark goes up extremely high, our goals got a little harder. So we're going to use those comparisons in the people area. So you've seen this when I've presented in the past. I know those are really small pictures, but they'll be up online soon. The three big things I want to point out to the scorecards were that stretch targets. You may see those differently if you've looked at them historically. Some of the numbers may be different, or in that 9 and 10 than they have been in the past. Second, in the past we have measured compensation by looking at a specific number of positions and then measuring that against some survey data that we have available in human resources to see where do we fall in the marketplace when it comes to pay rates. Every year when you take the employee survey, you answer a question that says, how do you feel you are paid, or do you feel you're paid fairly in relation to the market? We're going to start using that. We have the historical data. That gives me some stuff that I can work with Joni and Mr. Babb and Mr. Fulbright on what we can do to help people's perception of their pay, as well as possibly increase pay at times. No promises. Don't be calling me and saying, Jeremy promised pay increases. And then the third one is turnover. Especially when you look at the organizational scorecard, I want to point out that the measure in the 10, our stretch target, has changed. We have historically said there was a best in class that we had available for the organization, and that was 12%. But it didn't make sense math-wise when we looked at long-term care business unit, hospital business unit, clinics, home care. So this is a true reflection of all of us together. If all of the business units hit their target, we would hit our target as an organization, because we've seen that be a little different in the past. I also want to point out a couple of action plans. You guys are going to see a lot of other people action plans that are being worked on, but these are a couple that Joni and I picked out. We have a team working on competency, working with several of the hospital, I know, and some of the long-term care managers on how do we improve that? How do we measure that? Make sure that we're moving forward. You'll see that pay and benefits satisfaction team, and then also how do we increase knowledge and presence of our organization within the marketplace. So look for ways that you can be involved with those. If you have ideas or suggestions, turn those into those champions or those action plan owners. If you get asked to be on a team, bring great ideas, and we would look forward to that. Now, similar to Treg's, I wanted to give you guys some things that you can help us do to accomplish people goals. And if you go back and look at some of our previous presentations or some of mine, this is the same slide I always end with. Because it really is about the exact same things. When it comes to us as coworkers and as employees throughout the organization, it's all about how we do stuff. And Treg pointed that out really well. If one of us doesn't live up to the guiding service principles, that's what we think. We're not always at that point. And we have to be, because everything that we do, whether it's an interaction with a coworker or it's an interaction with a resident or a patient, it's all about the people. I know you guys do great jobs in what you do because I see all of your evaluations. I see your responses from your managers. But if we don't do it on one occasion, that's what people remember, okay? So I want to encourage you. I showed you earlier, we are a great organization, and people, I think, the best. It's kind of weird missing you guys. Don't see you all every year now, but I look forward to this, and I'm going to turn this over to Renee.
Good morning. I'm Renee Meyer. I'm the Director of Finance for the Foundation. I have been the Finance Flagpole Champion just since January. So the organizational Flagpole Champion is new to me. I have been the Long-Term Care Finance Flagpole Champion for quite a while now. So I've been with the organization 23 years. So hopefully I can bring good things to finance. We'll see on the our strategic plan to tie in finance with our strategic plan. We have an action plan. Right now, our major action plan for this year is ICD-10 implementation. I know many of you have probably been involved with ICD-10. We've got training. We've had online training, on-site training, off-site training. We have a 2-day training tomorrow for long-term care. So lots of things going on with ICD-10. Some things that we've got Meditech update actually next week that will update our software to be prepared for ICD-10. Physicians will be trained then too. I think they've already gone through some training. But so with the Meditech update, October 1 is when that goes into effect, the ICD-10 implementation. So through the month of October, November, we will be seeing lots of changes. And then with our claim filing, in order to prepare for ICD-10 for finance, we've actually secured some bank financing to be prepared in case our payers aren't ready to pay us. We think that we will be ready with all of our ICD-10 claims. We think that we will be ready to submit claims correctly, but we don't know if CMS or our payers are going to be ready to pay us. So we have actually got some bank financing lined up just in case, so that our finance measures, our days in accounts receivable and our days cash on hand, that we're prepared for that. And so we've also looked at our days in accounts receivable measures for the balance scorecard and taken that into consideration too, knowing that ICD-10 could impact us negatively. Hopefully it won't. We feel like we're prepared. We just hope that our payers are prepared as well. So that is the major action plan that we're working on in finance for this fiscal year. For our scorecard, the changes from 15 to 16 are very minor. We've actually left all of the goals the same, or the measures actually. The measures are the same. The results are a little bit different, and we base our finance results on the budget. So we prepare the budget, and then we align our goals for the balanced scorecard with our budget. So the major, we've got 5 major goals for the organization, and we've got operating margin, which is the bottom line. And then we've got labor cost per net revenue. So that is a measurement of what it costs for our staffing. So that's labor cost, salaries, plus benefits. And then we're measuring days cash on hand. That is actually a bond requirement that we have to meet. So that is one of our measurements. And then revenue growth. revenue growth measures this year's revenue compared to last year's revenue. And so we've got percentages of revenue growth that we anticipate with our budget, and with all of the new services we're providing, we do anticipate revenue growth. And debt service coverage, that last item, that is also a bond requirement. That shows how much cash do we have available, how much operating margin do we have available to pay our debt. So we continue to measure that as well. So that is the balanced scorecard. Now some things that you can do to impact our finance measures. This, like Jeremy said, this is the same slide. I think we've presented the same slide for several years now. These are some things that you can do as employees, as managers, in order to help us meet our finance goals for revenue growth. Support our CMH physicians, support our CMH services. Use our services and promote those services in the community. The communities that you live in, promote the CMH services and come back to us. That will help our revenue growth. Operating margin is it's our bottom line. So with the revenue growth combined with our expenses, we need to match our staffing with our volumes. So a lot of our labor hours are based on how many residents we have to care for today, how many patients are on med-surg today. So if we match our labor with our volumes, we should meet our goals there. Also, appropriate and complete documentation. So make sure if you're on the clinical side, get your documentation done accurately, timely. That allows us to get claims completed and out the door, and payers to pay us timely. Work within your department's budget. Hopefully everyone has received their fiscal year 16 budget information. And so you've got those numbers, you know what to work within, what boundaries you've got for your budget. And then the last item is the labor cost per net operating revenue. That again is a measure. We've got our revenue, and then we compare it to what it costs us for labor, salaries, and benefits. So we're continually looking for ways to become more efficient, and then also ways to minimize our overtime. That would help us meet that measure as well. So, any questions on finance? Nope. Thank you very much.
Good morning. I'm Debbie McQuaid, Director of Quality Improvement and Organizational Flagpole Champion for Quality. So just take a couple of minutes here to talk about our balanced scorecard. Falls with injury, we measure this the same way everybody else does so that we can determine how we're doing according to everybody else. So we look at the number of patients or residents who have fallen with an injury over the number of 1,000 patient days, over 1,000. So our numbers, if you look down here at the bottom, we actually had 62 falls with injuries the first quarter of FY13. And the fourth quarter of 15, we had 24 falls with injuries. So that has improved significantly. Yeah. Timely admit and treat, we're not going to be moving that measure this year because we didn't meet goal. That has to do with getting into the emergency room, being triaged within 15 minutes, getting into your specialty physician within a specified amount of time, or getting into your physician within 24 hours if you call for a family emergency or a family visit. So that didn't move, and a lot of that has to do with the amount of patients that are being seen by our specialty physicians. That time is longer than what we'd like, and Mr. Babb is going to talk later about some of the providers that we've added this year, so we think we'll see a change in that. Patient care continuum, that's looking at our orthopedic patients. Do they get all the care they receive to get? And also we added a couple of years ago our congestive heart failure patients. So we still have education and documentation to do with our congestive heart failure patients. Our orthopedic patients still remain 98, 99%. Evidence-based care I'm going to talk about in just a second. And information relevance and ease of use, even though this is dropped, this is a top box score, as Treg was talking about. Do you have all the tools you need to do your job, and can you find the information in the electronic medical record? This has been higher than this up until the last quarter. So I think with the updates we're taking and things like that, we'll see this bounce back probably around January when everybody gets used to that. So I want to talk just a little bit about evidence-based care. In long-term care, we're looking at 11 different measures, and those are the things that are reported on the internet by CMS. And they didn't have any changes this year, so those are going to remain the same. The clinic measurements, we did adjustments this year because we wanted to make sure that we were measuring health maintenance for our patients that were coming to our clinics. And you can see the measures there that we're looking at. I'm not going to go through every one of them, but we have had some adjustment to that business unit scorecard. The hospital, had, the home health, they have, I want to back up just for a second. Clinic is not reported on the internet yet. We are collecting data on the things that we assume will be reported. Home health, though, they have 22 measures that are reported out there on the internet, and they have had no changes this year to those measures. The hospital, also reported on the internet, CMS site, has changed significantly. They've dropped the pneumonia, they've dropped the heart failure, they've dropped the surgical care improvement project, and what they have picked up is the ones that I have listed here. They've picked up stroke, they've picked up VTE or blood clots, and emergency department measures. And those are for timely. So how long did it take from the patient coming to the door to see the doc? Or how long did it take from the time they made a decision to admit the patient to the time that the patient was admitted? So many of these have changed. And even with all of those changes, and going back and collecting the back data, Kim Tarka worked hard on that for us, and resetting our goals, it is almost the same goal as last year. So I think we'll do great in that. Our two biggest action plans for quality this year is to improve pain management. And Melissa Jennings is our action plan owner for that. She's with palliative care. I think she's a great action plan owner. And, you know, it says here we want to improve service scores for our patient satisfaction. But the truth of the matter is we want to improve the pain for our patients. We want that pain to be manageable. We want them to have a good perception that we're doing everything we can to manage their pain. And then appropriate alarms. This came out from Joint Commission a couple of years ago, that people, you know, they kind of ignore alarms because there's alarms going off everywhere. So there was a sentinel alert from Joint Commission saying you need to look at your alarms and you need to adjust them and make sure that when an alarm goes off that the staff can react because they know it's an important thing for them, not just another annoyance. So we've collected initial data, Deanna did that, and now we've turned that over to Jennifer Rainey. So that's going to be a big help in improving patient safety. So what can you do? Provide care effectively and efficiently. Make sure that we're looking at everything that we can and we're providing care using the guidelines that's out there, plus looking for other ways, looking for best practices and bringing those to your supervisor and saying this is the best way we could provide this care to our patient. Make sure we're doing it timely and that we're letting the patients know it's going to be 15 minutes, it's going to be 20 minutes. Also report patient safety concerns. You know, you can do that through the QRM module, you can talk to your supervisor, or you can talk to any one of us in the QIPI department, and we will help you to look at those patient safety concerns. Anything you feel is a concern, let us know so we can look into that. Also, there's a patient safety culture survey out there right now. Fill that out. We want to know what you think is the best way that we can improve the patient safety to our patients. So the most exciting thing I get to do today is to introduce you to Josh Ettinger. He's been working with us on our Baldrige journey, like Mr. Babb said, for the last year or so, and he's got some points to talk to you about. And so, Josh?
You all leave? You abandon here? Pressure is on. Okay, yeah, I'm not used to a podium either, so this will be fun. Yeah, I'm more like, I move around, maybe it's nervous energy. So good morning, my name is Josh Ettinger, as has been claimed by Mr. Babb and Debbie. I'm here to share with you the process you're going to be going through in 10 business days. It's just around the corner. And so I'll give you a little bit of some insight, some context, and describe for you how I think you can play a really fundamental role in this process. I want to first start off by saying that I don't believe for a minute, and I don't work with organizations that use Baldrige, whether it's at the state level or the national level, to win an award. Personally, that doesn't motivate me. I'm not interested in helping an organization send people to Washington, D.C. to receive the highest form of recognition that you can get for organizational excellence in the United States. What I am interested in is helping an organization deserve to be that recipient, and working with an organization that has done something very interesting and compelling that others in this country can learn from and can look at and say, wow. And I think that resides here in Bolivar. I think it resides here in all of you. And so while we are going to talk about an award, that was never the intent. I don't believe that was the intent. But there is something I do want from you. I want you to want to win because you deserve it, because you've reached that destination, because you've gone through the processes of looking at the organization and figuring out how can we be the best we can possibly be, knowing that perfection is never really achieved, but at least we're always working tirelessly to achieve it. And so let's talk a little bit about this process. Anyone have an idea what that is, besides the obvious that it's a number? It's what? Pi? It has a very close relationship to pi, but it's not. Yeah, there are some similar numbers there, but no. Close. So Treg said the percentage of places that get a site visit. So the Baldrige program has been around since the late 80s. And in the early 90s, healthcare was added as an official amendment to the bill. It's a bill in Congress, the Baldrige program. And since then, this represents the number of healthcare recipients when you compare it to the number of hospitals in the United States. Less than 1%. There are approximately 5,600 hospitals in the United States, according to Google, and who's pulling it from AHA. This is a very elite club. This is a very select designation. It's bigger than Magnet. It's bigger than really anything. It's a presidential accolade that's saying you need to learn from this organization. The award was started to highlight organizations and companies that were doing amazing things so that others in the United States could learn from them and all boats could rise. I think you could maybe make all boats in healthcare rise. And you have 2 weeks to execute that. And I don't say that to scare you or put in fear, because this is not an interrogation. It's not something that you have to fear. This is a moment for you to have a conversation and a dialogue and to share all the things that you've done, to share all the reasons you get up in the morning or you come in late at night to work. So it's a very select club. It's climbing Everest. So when we think about some of the things that have been said so far, always organization. What does that really mean? Does that mean 99%? It means every. I remember someone early on in my professional career, probably 15 years ago, when high performance was early in the stages of even being contemplated, wrote on the board, what if we could get to 99, 99, 99? And everyone in the room said, wow, that would be amazing. But then he went across and he said, well, so there's 1% here we're missing, there's 1% here we're missing, there's 1% here we're missing. What if your family member was that 1%? And so even 99 is not great. It's not always. And we have an obligation to deliver always. We have an obligation to be highly reliable. And it's very, very difficult to be a high reliability organization, not just in patient safety, but in everything we do, every single interaction. It's hard to be reliable in our own lives. Good husband, good father, good brother, sister, mother. It's very difficult. But you have the tools, the systems. It's why you have process-based management. It's why you see the guidelines and the recommendations up here, because those are the things that will help you stay close to reliability. and will keep you focused on the things that your customers and those in this community really want from you. So down in the left-hand corner, that's what we're after, because you deserve it. It's a piece of glass. It's by a company called Stubend. If you say it really quickly, it sounds like stupid. But it's not. Stubend glass. And what it means is that if you become a recipient, 50 of you are invited to, they've moved it to Baltimore for hotel reasons, but to go there and stand up in front of the country and people who are coming and saying, here's what we do that's role model. Look what we've done here in Bolivar. Would you believe it? I think you have that. You have a group of people who are coming here in 2 weeks who are very knowledgeable about the Baldrige framework, about the questions that are in the framework. Don't let that intimidate you. You know your business better than they do. They don't work here. They don't live here. They'll ask you questions, but there's no right or wrong. You just tell your story. You talk about the things that you've known for several years, and you will shine, I have no doubt. They know healthcare, so you can have intelligent conversations with them about healthcare. Not all of them are from healthcare, but many of them are and will have experience and background. They're here to verify and clarify. You know that there was an application put together. A lot of work was spent, the time and it was spent on that. They're here to see, was it a fairy tale or was it true? The good news is, from my interpretation of your application that you submitted, you're better than the application. And that's on you to share and to show that and to your colleagues. And I know you can. Anyone ever see those 4 letters put together? Raise your hand if you have. So a few of you. That's okay. Don't worry about it, because you know it. You just don't know it as it's on the screen. What they are looking for is something called approach, deployment, learning, and integration. In other words, they want to know, what is your process for doing something? What is your process for measuring customer satisfaction, for addressing complaints, to listening to your customers' expectations? And you have processes, do you not? You have steps, you have things that you follow. They want to understand, are those processes happening everywhere they should happen every single time, as they are designed? Not that this organization functions in chaos. That's why you have process-based management. They want to understand that you know that those processes are effective, that they're working, that it's not because we've always done this way is how you measure performance, but that you have real data and metrics. Some of the stuff you've seen on the screen already. Some of the things you talk about in your weekly and monthly meetings, your scorecards, your metrics. How do you know? And how do you improve those processes so that you continuously get better and better and better? And lastly, that the processes and the things you do here today are done because they meet a need. They meet a need of a physician who's a partner with you. They meet a need of your colleague in the workforce, a patient need, a community need. They're on your strategic plan. It's a regulatory need. That there's a reason that you do everything and it's not, I don't know, just because. Because that doesn't add value. And it's important. Last time I checked on the campus, there's not a garden with a bunch of money trees hanging. Is that, you don't have that here? Right. Well, I don't have that either, or know anyone that does. And the obligation to do everything we can to create value and go beyond creating value and to do it in an effective and efficient manner is what a lot of this framework talks about. And why you adhere to the guidelines is because those are the ways that if you know if you do it, it works well. I'm going to get on a plane later today. There's a checklist that I really hope those pilots go through, that the groundskeeper go through. If they don't, I don't want to know about it. And if I did, I'd take the next flight. There's a reason. So, they want to find out what's unique in role model. I think a lot of things you do here are unique in role model. The way you reach out to the community, the size of the organizations you've built here in this community, the things you do with your physician relationships, the services you provide, the engagement you have with one another. It's amazing things. Your clinical results in many areas. Not perfection, but really unique things. So from you, what can you do? Tell your story. As I've said before, be who you are. Be passionate about it. I mean, when Jeremy's up there saying those levels of engagement are really high. I mean, the 90+ percentile across the United States, you know how hard it is for people today in healthcare to be engaged in what they do and be excited? I know every day might not be puppy dogs and ice cream cones and rainbows and marshmallows, but most of the time maybe it is. And you know how hard that is? I travel around the country. Not everyone is happy. Physician relationships are not great. You have that here in spades. Be passionate about. Go back to the things that you know, your mission, your vision, your values. These fast facts, which either they've been passed out or they will pass out, that tell you the things not to make you rehearse and prepare and to study, but to remind you of the things that you know. Because they're going to ask you questions. Some of you have had it with them, MQA. Why do you work here? Or how are you evaluated for performance? Or if you have an idea, what do you do with it? If you've been on have you ever done a Just Fix It and Make It Better? Stuff you won't know. What was orientation like? What kind of education and training do you receive? How often do you see the executives? All stuff you know. Be passionate. I'm redundant with the passion because I want them to feel, I want them to walk away because they go back to their hotel rooms every single night and talk to each other about what is it that they found? What is it that they heard and felt? And I want them, because I believe it's real, to feel goosebumps when they describe the things that they hear from you. I want to set you up for success to tell your story so that when Friday, October 2nd comes, you know that you did everything you could to demonstrate to them that you are worthy of this less than 1% club. They want to know about process, as I've described, and I really want to reinforce for you, there's no wrong answer. I once had I'm an examiner as well, and I once had an experience where I did a question with her, and then later on, one of, I guess, their supervisors or leaders came up to me and said, so-and-so would really like to talk with you again. She feels really bad because she didn't give you the right answer. And then I was like, okay, it's not a big deal. We speak to a lot of people. You don't take an N of one and suddenly make a decision about it. But sure, she cried to me that she was so upset that she thought she was going to lose their chance within this process. Ultimately, they became an award recipient, but don't take this as you can destroy or ruin anything. It doesn't work like that. There's no wrong answer. And as I mentioned, the fast facts. So I'm going to leave you with, we started off, I showed you Everest, the 1% club. It's truly unique. It's truly distinctive. So I want you to reach this summit. You can do it. I know you can. But even more so, I want to be able to see this picture come April 2016. That's at the National Award. So, any thoughts, any questions before I hand it over to... Good to go? I'm excited. Be excited. You can do it. And I look forward to all your future successes. Thank you.
Josh, thanks. Josh can stir up the excitement in the room. You know, he's been great to work with, he and his father, and, you know, we've come a long way under their direction, and we've made a lot of improvements. And, you know, I was going to talk a little bit about, you know, our Baldrige site visit, but I think he's covered most of it. But, you know, the things I would just remind you is that we want to talk about our accomplishments, you know, how we've done the things we've done, you know, the story that we work from, the story of CMAH, how it started, how we've progressed, how we've achieved all the goals that we've set and where we're at today. And remember that the examiners are lay people that are volunteers to do this. So they're here to help us. I mean, their goal is to help us reach the goal that we have. And so it's, as Josh said, it's not something to be fearful of. It's something that we'll learn from, and just be yourself. I think that's the most important thing, because I work with you every day, and it's nice to come into the room where you're at and have a conversation with you, because you're people that communicate the things that are important to you. And I think that's the story that they want to hear. And the feedback we get a lot of feedback through our strategic planning process, the process improvements that we have. And the main thing that we look at as an organization is the long-term sustainability. And we've talked about this a lot in all the meetings we have, because healthcare is changing. It's not what it used to be. And the monies that we used to gather in payments, we don't get anymore in the same fashion that we did in the past. And it's less money, it's more restricted. So we have to think kind of outside the box to do the things that allow us as an organization to grow and meet the goals that we have in sustaining healthcare in the communities that we serve. The organizational goals that we have is just, focus on our service. Expectations of the organization, as Craig talked about, that's a 75th percentile for this entire year. Additional training in our departments, things you need to think about: bumping their clock, 3 o'clock, the parade. Give them the pickle. Those are things that you're taught, you think about. The tactics that everyone needs to be aware of are the things that we're talking about here today. Aid it, and narrate your care. I think Craig did a great job in talking about that. I think that's so important. And when you get the reports back from the patients after they've been here, they're very mindful of the fact of what you're doing, and they will acknowledge that in their reports back to us on the care they receive. So those things are very important, and I don't think you see that in every organization. I think you go above and beyond. We're not perfect, as Josh said, but our goal is to get to that perfection state and stay there. That's a goal that we've always had. I think as the organization continues to grow, the things that we have to do is bring the right people in, whether it's physicians, mid-level practitioners, professional people. All of you as a workforce, have to be committed to why we're here. So in this last year, we've added a lot of physicians and a lot of mid-level practitioners to the organization. I'm not going to read all of them to you, but you can kind of glance through those, and those are since June of 2014. And then we have a continuation of those, and we've grown a lot. I think we have probably in the neighborhood of 150 practitioners, physicians and mid-level practitioners within our organization. Something that's really, you don't really think about, and you probably don't see it enough, but with these additional practitioners and physicians that we brought in over the last year, our clinic volumes in the last 6 months have gone from 16,000 visits a month to over 20,000 visits a month. That tells you a lot about what you all do, and as an organization, what we're doing to bring better care to the communities. And you can't do it without good people. We talked a little earlier about our physicians and the new physicians that we bring in. We always bring them into a group, and we have breakfast or lunch or dinner, and we talk about the opportunities for the new physicians coming in. And it's kind of interesting to sit and listen to the existing physicians say, the reason that we come here and the reason we stay here is because we get to practice medicine the way we were trained to practice medicine. There's no one telling us how we have to do this today. And there's no hierarchy in Kansas City or New York or Chicago or St. Louis that dictates to us what we do and how we practice medicine, what our goals are, how many visits we have to have today. If you let them do what they're trained to do, They'll do a much better job, and you'll see the growth that we've seen in the last several years, not just the last few months. And then, since June of this year, these are new physicians and mid-level practitioners that we brought into the organization. And starting the 15th of September, Dr. Plum, a new dermatologist, will be starting with us. He'll be in orientation and Meditech training and all that first week. But starting on the 21st, he will be in a clinic across the road and the upstairs of the surgical center that we're in the process of completing right now. So he'll be our first physician in there. And I'm excited about that. And then the new mid-level that we have to walk in. And in October of this year, we have those individuals starting. And in November, we have another mid-level at Dallas County. And in 2016, we already have 3 physicians that are signed up to begin practice here in 2016. When you think about that, that's pretty dynamic. That's probably a goal that a lot of organizations would like to have. But if you don't have the right personality of the organization, the right culture, and the right people, those things do not occur. They just do not come here. And it's much easier for us to recruit now than we ever have, because we have a face of professional people that want people to come here and be a part of what we do, and you're those people, and we have to continue to work together to continue to grow the organization and go where we want to go. Talk a little bit about some of the projects that we've had this year. All of you know that last October we purchased from Osceola the clinic, the ambulance service, and then we developed a rehab program up there with PT, speech, and OT. And the clinic in itself, we've hired Dr. Ford came in, and he's the lead physician in that group. And that clinic continues to grow every month, and it's something that until we really had the clinic there, I had no idea what was happening with where people were going. But most people were leaving that area to go elsewhere for health care. So we're starting to bring those people back now and be a part of the organization that we've established. The other thing that we've accomplished this year, and we opened our surgical center and medical office building across the road in March of this year, and we opened the downstairs lower area where we had admissions for surgery and endoscopic procedures, and then we added the surgical physicians over there, the hyperbaric chamber. A lot of the services moved from here and the professional building across the road. And if you've been in that building, you can see the significance of that building and what it means to those patients who come in. So the growth we've seen from that new building and the new physicians that have been brought in has been pretty tremendous to us. We were averaging probably in the neighborhood of 25 to 30, 35 surgeries a day. There's been several days since we've been in that new building that we've hit over 50 surgeries a day. That's big. That's a big movement of people coming here to have those procedures where they used to go elsewhere. Basically, that was Springfield. We have a new OBGYN clinic and PEDS clinic that we're getting ready to open. Dr. Mintz, Dr. Kahlberg, and Dr. Lane will be moving their equipment and all into their clinic starting the 18th of this month, and they will actually open for service on the 21st of this month. The PEDS clinic, we're probably a month, a little over behind opening it. We're probably the latter part of October maybe we'll have it ready. But then we've added another new pediatrician, Dr. Leeson. I don't know, many of you have probably not met him, but he's been at the University of Missouri for about the last 10 or 11 years. He ran their pediatric urgent care clinic, and he's going to be a great addition to the physician group that we have. Excited about him being a part of that. Then the other part is Baldrige Technical College. They've been in a small building location on the west side of town, and we're building a new facility for them, actually in Jeremy's some of his areas will be over there. The education department will move over there as well. But you know, we're going from a very confined, probably a 9,000 square foot space for the nursing school into a 28,000 square foot space. So we're expanding their labs. We're expanding a lot of the technology that they have, and you're going to have an environment, I think, that will interest a lot of the students and bring more students in. The other thing that Charlotte Gray has worked on, we've wanted to increase the RN graduate program. So she has to go and she has to apply to the state nursing board to accomplish that, and she's done that. And they've basically said to her that we're going to be able to start an every year RN graduate program rather than every other year, and that would start in 2016. We already do the LPNs every year, but to have the additional RNs that come out of that program every year will really be a benefit to us as an organization. Yeah, it helps with those employment fairs that we have, and Treg does an outstanding job with those. You know, the other thing that isn't on the screen that's been a big service that we've started and a partnership that we've started. In July of this year, we took over the management of Appleton City Hospital, Elliott Memorial. And so our goal there is to help them improve the services, recruit physicians, provide new services to their communities, and really kind of make their organization grow in a way that we've grown. Now, they have a much smaller service area to draw from, but I think we can expand that as we move along. So, you know, that's really our first management contract of another hospital, but it's been kind of fun to do. And, you know, it's a challenge when you have processes in place that, you know, that people follow. But there, it's a point of training and bringing all those people up to the standards that we have. You know, Tom Hollis, who's their CEO, we moved him to the hospital or to the foundation side. He's employed by us. And Kathy Meninga, who's their chief clinical officer, is also employed by us. So that gives us the ability to have some control day to day of what goes on over there. And I think those are things that will allow us to see the improvement and the growth that they're wanting. Some of the things that we've done already in working with our VHA contracts for purchasing supplies and the drug contracts that we have for medications, to implement that in that program over there will save them instantly about 10 to 20%. So that's a pretty sizable shift in their cash flow. The other thing is they have a bond finance that was done back a few years ago when rates were really high, and so we're going to try to refinance that for them. If we can refinance it where we think the market is, that alone would save them about $250,000 a year. So between those two items alone, you know, there's a $500,000 savings to them operationally and the expense side. So, you know, it's kind of neat to be able to do those things and make them successful and be where they want to be. You know, the Osceola Clinic, when we bought that, took it over, we've gone in and you know, our construction people have really rebuilt the inside of that clinic. And so this is a view of the waiting area and reception area as you walk in. And then the exterior view of the building, it sits back up on the hill behind where the hospital used to sit. It's turned out to be a very, very nice clinic, and I'm really proud of the work that our people do when they went in to remodel that and make it more attractive to the community. This is our upstairs in the medical office building across the road, the Douglas Center. You can see this area. If you've been over there in the dining room, this area here had a partition in it, and you couldn't see that area. So now it's opened up. So this is part of the new area, the waiting area that's opened up on the upstairs in the area where the cafeteria is. And this is the front elevation. This area is the OBGYN clinic. And then you can see some of the interior part of the reception area there. But they're in the process of doing the final work. I thought they were going to do asphalt this week, but of course we had rain. So hopefully we'll have it done by the time they move in or before they move in. And this is the back view of the same building. And this is the pediatric entrance on the west side. And, you know, when you look at that building from the front, it doesn't look that large. But you drive around the back of it, it's a pretty good-sized building. There's about 17,000 square feet in that building. So it'll give them an opportunity to grow their practice and to increase volumes. And in the PEDS clinic, we're going to start a walk-in over there after we get that part of it open. So pediatric walk-in clinic, well, I think will be a big benefit to the community. And this is the BTC College. And if you look at it today, it would look a little different than that because the wraparound brick is around on the front side now. But the building, we were held back with rain. We couldn't get the roof on, so there's not much we could do on the inside. But Steve and Robbie have worked well with the contractors, and they're moving along fairly quickly now on the completion of that. And then El Dorado Springs, you know, I think at our last planning session I talked about we were working with Mercy and El Dorado to take over the Mercy clinic there. That did not work out the way that we had hoped it would. So we're in the process of getting ready to bid our clinic, which we're going to build in El Dorado Springs. And it's on the property of where the nursing home is. And this building will face the ER and the Mercy clinic across the road. So it'll take us probably 7-8 months to build that. So we're looking at next late spring to have it open. So Don is working diligently to bring a couple new physicians in, and hopefully, you know, bring a lot more of those services to our facilities here. And then last, we have the Stockton Nursing Home, the new nursing home. And really all I have here is just the exterior view. That's the main entrance. And that's just an elevation view of the exterior part of the patient wings. That'll be a 90-bed facility. And we bought property adjacent to where our new clinic is in Stockton. And so that'll set back. We have a total of about 12 acres there. But this will set on the back side of the property, and it'll overlook a huge valley to the west, which would be a really nice setting for our residents. And, you know, and I think the other thing that I haven't shown, but that we'll be working on is the CMHCF facility that we have in town. As we know, is an old facility. We can put new faces on it and paint. We can't change the structure and the way we operate. So we're planning on building a new facility to replace that, and we'll probably start working on that sometime after the first of the year. The other option that I'm looking at is that there's 16 acres of property on the west side of where the new nursing school and clinics are, that I'm hopeful to buy that, and then we would build a new facility over in this area and set up on top of the hill and overlook this whole valley. And it would give us a lot of opportunity to continue to grow our campus and expand down the road. You know, with that property over there, we probably have somewhere in the 50, 60 acre of property that we can grow on if we acquire the other property that we just talked about. So, you know, we have a lot of things going on. We have a Baldrige visit coming up on the 28th, which, you know, to me, I'm just excited about the fact they're coming, you know, and I think to achieve what we've achieved to get to this point, there were 16 healthcare organizations that had submitted for a Baldrige visit this year, and there were only 8 chosen, and we were one of those 8. So I think we need to take a lot of pride in that and make sure that we're ready for those examiners when they come. Now, Josh has been a big help to the senior leaders, and the senior leaders, we need to go out and work with all the other people to make sure that they understand it's going to be similar to what the MQA was, where they come out and they talk to staff, and they just want to know if you know what our plans are, what our organizational goals are, what processes we have in place, you know, how we address people, what we've learned from Studer. You know, we've gone through a lot of training, and I think we've all benefited from that. You know, you work in healthcare for a long time, you think you know what goes on. You find out when these people come in, you learn things differently. And I think that's good. It helps us advance the organization. So if you have any questions, I'd be happy to answer those. But really appreciate all of you being here today in attendance, and those on our WebEx and telehealth. It's nice to have everyone in the organization listening to the presentations that we've had this morning. So to Treg, Debbie, Renee, and Jeremy, and Josh, thank you all for being here. Really appreciate your presentations. You do a great job, and I think the leadership that they provide is exceptional as well. So any questions? I know we've thrown a lot of information at you, and you're not going to remember it all, but we have slides, and we'll share those. So with that, thank you. Thank you all very much.
Good job. You did a great job. Love it. Did you turn this off?